thoughts. Thank you.
Thank you. Nice summary, George. I mentioned before we broke for lunch that, or for the work groups, that the topical categories for the four concurrent groups are really cross-cutting, and I think you'll hear as you listen to the readout themes that cut across all these topic areas. I also think that legislator maybe should be nominated for a Purple Heart or something like that. Okay, group 2 is focused on the natural and built environment. JT, do you want to discuss your group's findings?
Good afternoon, everyone. We had a fairly robust conversation. We enjoyed it, and given that a lot of our content area dealt with the environment, natural and built, we tended to focus more on a lot of the regulatory aspects of what falls into that, but we did branch out a little bit. But some of the themes that emerged from our discussion was that that the modeling has, we think it's proven itself, at least among all of us, that it's great for long-term problems and concerns, but that we also found that there are some limitations when it comes to something more immediate that we might be dealing with in public health. And Koya on our group actually gave a really good example of that, which was, if you're dealing with an infectious disease outbreak immediately, that, it would be much more difficult to apply a model in that way, and we've got to find ways to do that. And her actual analogy was, basically that people may want a forecast, get up in that morning and see their weather forecast and what their likelihood is to get the flu that day, and so they may wash their hands a little more often. And so there's a little work that on that front that we thought that we identified. Barriers. Given that we focus again a lot on regulatory, but for governments and all organizations that currently aren't using this, there are still resource gaps, both between people and expertise, and I think that it's going to be a little bit of those organizations just physically lacking the people, but also there may be opportunities as well for partnerships between those organizations and academia and others that can bring those services to bear. We'd still need, obviously, resources for that. The education and understanding about the use and value of modeling, this actually applies for in two different ways. One, among policymakers in general that aren't currently familiar with this as a way to move policy. There's an education that needs to take place there. And then also among the general public, and one thing that I brought up that I've learned, in my job is that we oftentimes think there's a lot of great ideas and we want to move forward on one initiative, but there's a significant amount of time that must be invested, that once we have the model and we know that it's sound and our policies that we want to propose are great and mean a lot to the people that we serve, that there's a lot. That doesn't mean they're going to understand it, number one, and that doesn't mean that there's not going to be a considerable amount of time needed invested from leadership, from stakeholders, et cetera, to sort of do a roadshow in whatever geographic area you might appoint to sell the idea of it. And so I thought that one was particularly really important. We thought about putting it under resources, but I really wanted time to really stick out, because I think that we sometimes underestimate that there is a great investment that we have a responsibility to take on to going and spreading that message to everyone, so that they both understand the model and understand our policy goals, so that it minimizes concern on the back end or any pushback. And then the last one we identified was that there seems to be high expectations about what models are capable of doing, and we need to really reinforce that models are decision helpers, not decision makers, and maybe we'll get to that point one day soon, and I'm sure that's different to a great degree in many ways, depending on the project. So that was another barrier we identified. Who's got that? He's clicking.
Great, thank you. And again,
I have one more slide.
Oh, I'm sorry. I thought you were...
All right. So opportunities, using models as sources of innovation. We started out that part of the conversation with that they could be stifling innovation because we're basing it on assumptions from the beginning, based on assumptions that are based on evidence that we've previously developed. And in fact, what we did come to the realization is that they can be a source of innovation, that once we get to the point where the model is robust enough, then we could actually change out assumptions or factors to be more innovative and test new theories. And so that was one thing. And then the opportunity also, too, is that they could help us develop and hone our priorities across the map. And then our big idea was to explore really deeply a scientific way to capture a way to model social and cultural values. And we touched on that earlier, but really see that as one place that really is worth time for all of us to take a look at. So, thank you very much.
We got a minute or two. If you wanted to elaborate on that last point about modeling social and cultural.
Well, one example, Ebola, looking at examining, one of our group members had the idea of examining the burial rights in West Africa and the impact on the spread of the disease there, and whatnot. And so, how can we in some ways scientifically account and quantify and give a scientific value to cultures and values in various societies to modify our models so they're more, again, accurate and responsive.